Goni skill, wrist flexion. Position the patient in sitting next to a supporting surface with the shoulder in 90 degrees of abduction and the elbow in 90 degrees of flexion. Position the forearm midway between supination and pronation so that the palm of the hand faces the ground. Rest the arm on the supporting surface, but leave the hand free to move. Avoid radial and ulnar deviation of the wrist and flexion of the fingers. Remember to test the unaffected limb first. In patient-appropriate language, ask the patient to flex the wrist. Assess the forearm for supination or pronation, the humerus for motion at the elbow, and the fingers for flexion. Flex the wrist by applying a force on the dorsal surface of the third metacarpal, moving the hand toward the floor. Maintain the wrist in 0 degrees of radial and ulnar deviation. Stabilize the radius and ulna to prevent supination and pronation of the forearm. The end of wrist flexion range of motion occurs when resistance is felt and additional motion causes the forearm to lift off the supporting surface. Assess the infield of the joint. This is firm because of tension in the palmar radio-ulnar ligament, oblique cord, interosseous membrane, and pronator teres and quadratus muscles. You're now ready to measure the joint range of motion. Make sure you expose the bony landmarks you will be using. The size of a smaller plastic goniometer will make this measurement easier. Align the axis of the goniometer on the lateral aspect of the wrist over the triquetrum. Align the stationary arm with the lateral midline of the ulna using the olecranon and ulnar styloid processes for reference. Align the movable arm with the lateral midline of the fifth metacarpal. Do not use the soft tissue of the hypothenar eminence for reference. Ask the patient to perform flexion of the wrist as done previously, maintaining the goniometer in alignment through the entire range of motion, and observe for any extraneous movements of the forearm. Read the degrees of motion on the goniometer and then ask the patient to return the wrist to the starting position. Remain at eye level of the goniometer when reading the measurement. Make a note of the amount of degrees measured. Measure twice. If the measurements are off by greater than 5 degrees, take a third measurement. Take the average of the measurements and document it in the patient's chart. Average range of motion, according to the American Association of Orthopedic Surgeons, is 80 degrees.